National Heart Health, and recently the American Heart Association announced some new recommendations when it comes to women and heart health. So I'm joined now by Dr. Syed Zaidi, who is a cardiologist with Healthcare Partners, to talk about keeping our heart healthy. Thanks so much for being here.
Thank you for inviting me.
So I guess we can start sort of from the bottom up. What's happening when we're having a heart attack, and is there anything we can do for ourselves or for someone else when that's going on?
So what's happening during the heart attack, that there is a rupture of a plaque in the artery, which leads to either a partial or complete obstruction of the artery. So once the artery is blocked, there is lack of blood supply to that part of the heart. And slowly, if the artery is not opened up, that part of the muscle supplied by that artery slowly starts dying. So the sooner the artery is opened up by either a clot buster medication or by interventional techniques, what we as interventional cardiologists do, the better the survival of the patient is. Because if that part of the heart, which is supplied by the artery, is a big area, that can lead to heart failure or even can lead to death.
Of course.
So what one can do is to recognize the symptoms of the heart attack.
So let's talk about that, because many times people think it's in the arm and the chest, but for women it can be slightly different symptoms, right?
Yes, definitely you are correct. Like in women, in men the typical presentation is like a heavy chest pain, like elephant sitting on the chest. But for women it could be atypical, like the pain could be in a different location, like in the jaw or the throat or in the upper back area or in the lower abdominal area. Or they can only present with significant shortness of breath or palpitations and nausea and vomiting.
So, I hear that for women, heart disease is the #1 killer of women. Is it because we don't know the symptoms, or we're not doing enough to prevent a heart attack?
Yeah, I think you're right, heart disease is the #1 killer of women. But there is a good piece of news also, that in the last 10 years, the number of deaths per year in women have decreased from 500,000 per year about 10 years back to close to 300,000 per year in the recent data. This decline in heart-related death in women is most likely because of the increased awareness in women,
right?
Leading to better modification of the risk factors which causes heart attack, like diabetes, high blood pressure, high cholesterol, smoking, and obesity. So although the awareness has increased, but it is not up to the level, because the recent data also shows that in the United States right now, only half of the men are aware that the heart disease is their #1 threat to their life. So by increasing the awareness, I think we can do better.
Okay, and that's what the month of February is all about, to increase awareness, watch our diet. If we do anything, just get out and take a walk every day. Do something to make our heart a little healthier.
Definitely.
All right, doctor, thanks so much for being here. Important advice. We appreciate it.
Thank you very much.
And we'll be right back after this.